Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore. So in the world of senior care, one of the most misunderstood components of senior care, I think, is hospice. A lot of people have misconceptions of what hospice is and what hospice does. So here today to talk about the three most important things you need to know about hospice are experts in the field. With us today are Greg Hahn and Jessica Empeño with LightBridge Hospice. How are you guys doing today?
Very well.
Great.
Thank you, Bryan.
Thank you.
Good. Well, thank you very much for coming. Like I said, it's a very misunderstood component of senior care. You probably get that all the time in your work with seniors. You have a lot of explaining to do. So we're going to do a lot of education today for our audience. We're going to start with Greg. The difference between hospice and palliative care. People hear those terms and sometimes they use them interchangeably. Tell us the difference.
Well, I'm going to talk about hospice. Jessica will explain a little bit about the palliative care side. The difference really is that hospice is patient-focused. It's about patients that we can care for in their own home or whatever the environment is that's considered their home. It's a philosophy of care. It isn't a building. That's one of the big misconceptions. A lot of people think hospice is a building out there somewhere. It is not a building, it's a philosophy of care. It's designed for patients that are no longer pursuing aggressive curative treatment for their illness or their disease. So what we do is we bring in a complete clinical team. It's composed of our medical director, RNs, LVNs, social workers, spiritual, and then we also have a whole component of volunteers that provide our integrative services. So it's geared, it's patient focused, but it's all encompassing. It includes clinical attention to our patients and then the emotional support for family members and supporting them during this journey. And it's a wonderful experience. A lot of people have misconceptions about hospice. Many times we hear from patients and families, we only wished we had done this sooner because they've procrastinated or they've waited. And once the patient is on service and they see the services we bring to them and how we can put a patient and family at ease during this transition and journey, they're elated to know that we're there to support clinically the patient and emotionally the family.
I'm sure. And
Yes.
so Jessica versus palliative care.
So palliative care, I would say, is even more misunderstood than hospice.
Okay.
So there are different types of palliative care, and I think most people are familiar with the palliative care that's provided in the hospitals. Most every hospital, especially in San Diego, has an inpatient palliative care team, and they're wonderful. But outside of the hospital, once people get home, the options are few. And it makes it even more confusing because a lot of hospice providers have that in their name, hospice and palliative care. So palliative is really, it's a fancy word for comfort care, where we're focused on the comfort, the symptom management. We're experts in pain management for people. And what's unique is that LightBridge is able to provide that in people's home. Unlike hospice, palliative care is available to people at any age, at any stage of their disease. So people can still be going through active treatment. We have a lot of people that are going through chemo, getting blood transfusions, those kinds of things. They're continuing treatments, and they may or may not be at the final stages of their disease, but they still have those symptoms from their disease that we're trying to manage. Palliative care providers are experts in really looking at the whole person, head to toe, what's going on with them. They're not just focused on a specific body part or even just a specific disease. They're looking at the whole person and what can we do to support them in their home, to keep them at home and keep them comfortable.
Got it. And how is that paid for? How is that covered?
So that's one of the most important things, right, is what is it and how you pay for it? What does insurance cover? So there definitely are differences between
Yes.
hospice and palliative care and the way that things are paid for and covered. Hospice is one of the few great original Medicare benefits that are left. For hospice care, Medicare will cover services at 100%. So there's no cost to family if somebody has Medicare, Medi-Cal. If they have a commercial insurance, things can be different. So we always work directly with that insurance company to find out what's exactly covered. But most people do have Medicare, and everything that hospice provides is 100%.
And it's covered under their Medicare Part A
Yes,
benefit.
thank you.
So unlike palliative, which is their Medicare Part B coverage.
Right.
And that's the other big misconception, and I don't mean to interrupt you, but that's the other big misconception. A lot of people don't understand even the differences between their Medicare Part A and their Medicare Part B benefit. So something I've been putting out there for years, and I'll have people come up and tell me this. They're like, I remember what you said about the Part A. Just remember the 3 H's. Hospice, home health, hospital. Those are your 3 Part A coverages for your Medicare. So hospice is 100% covered under your Medicare Part A benefit, which is wonderful. There's no deductibles, no out-of-pocket expenses.
Okay.
Palliative care is usually paid for like any other visit to a specialty provider would be. So you go to the oncologist, the cardiologist, the nephrologist, you see a palliative physician. And we work with the insurance company, so we'll be able to tell people right off the bat, here's what your insurance covers, here's what you can expect your copay to be, so that they know exactly what they're dealing with. And all hospice providers work really hard to make sure that families are well prepared and understand what they may be responsible for, so we'll be able to walk people through that.
Got it. So Greg, when is it time for someone to search out and seek hospice care?
So usually we would get a call from either a provider or a hospice or a hospital or a doctor's office or whatever. And a lot of times what I will hear from a family member or even the patient is, my doctor told me there's no more they can do for me. And my response to that is, there's always something we can do. And we start having the dialogue about, hospice care and what that looks like and what that entails. And the whole philosophy of hospice is, if a physician decides or determines a patient has a diagnosis, and if it were to take its normal progressive course with no aggressive curative treatment, that there's a likelihood a patient could die within a 6-month period. And at that point, they would then refer a patient to hospice care. We come in, we talk to the patient and the family, and we do it in a very gentle approach, because there's also a misconception about hospice. It's about dying. And the first thing we want to convey to the patient and the family, it's not about dying, it's about living. Mm-hmm. It's honoring your life, offering you a quality of life, and offering you a peaceful, painless transition, which is what any of us would want. And and most patients today are much more aware of their diagnosis, and they want to know, what are my options? And if you come in as hospice, what are you going to do for me? And once we kind of put them in a, peaceful state, so to speak, they're open to having us come in and provide that environment and that care for them.
And I would add too, for a lot of people, they can consider it's time for hospice when the treatments that they've been receiving maybe are no longer effective, right, or they don't want those treatments anymore.
Exactly.
We hear from a lot of people that they just want to be at home. They just want to focus on quality of life. It's not about the quantity. They want to focus on comfort, being at home, being surrounded by their family, and stay out of the hospital. Stop going to the hospital for everything. I think so many people are so used to calling 911, going to the hospital every time there's a crisis. With hospice, we are your 911. Call us first. We have nurses available 24/7 that can walk you through things, help with medications, answer questions, all with the goal of keeping you at home and comfortable.
Absolutely. And we work closely with a lot of the cancer centers. And many times when a patient has gone in for like their first chemo treatment, it has just been such a horrendous experience for them. After just one treatment, the patient will say, I don't want to go through that again. And then the doctor will say, well then, we can refer you to a hospice that can help you. And the patient by their own admission will say, that's what I want. I just want to go home, spend as much time as I can with my family, be comfortable, have the hospice people come in, take care of me and take care of my family.
Right. So those are two of the things that people really need to know about hospice. The third, and maybe most important, how do you choose a hospice company?
It's a great question because there are a lot of hospice providers in San Diego County that serve San Diego County. And I think one of the most important things for people to understand is that they have the right to choose the hospice company that they want to work with. There may be recommendations coming at them from the facility they live in, from physicians, from hospitals, but ultimately it is the patient and the family's choice. So we hope that they feel empowered to do their own research and really feel comfortable with the choice that they're making. So meet with different providers. Have the different companies come out to you, come to your home, sit down, and answer your questions. You might want to ask them things like, how do you handle 24-hour staffing? What if there's an emergency in the middle of the night? What types of services do you provide? How do you ensure the quality of the care that you provide? I also would recommend people look for somebody who is located in San Diego County that has an office. If you want to go stop by their office and make sure they truly are there, be able to go see them in San Diego County. And look at how long they've been in business. I think that's another important thing because that shows their track record. It shows that they are compliant with Medicare regulations. You might also want to consider whether or not having that Joint Commission accreditation is important to you, which indicates a higher level of quality and commitment to the services that are provided. One of the other really good things that people can look at is Medicare, who handles all the regulations for all hospices to be Medicare certified. There is a website, and it's called Hospice Compare on the Medicare website, and that will give you the ratings, how all the different agencies have done on their surveys, their compliance, their complaints, and that can be another tool to help choose a provider.
Great.
The other thing too, hospice, we always want to let families know, it's a non-binding contract. It doesn't mean that if you come on to hospice today, you're in this till the end. If it isn't working for you, or if you want to pursue other avenues and go back to aggressive treatment, you have that right. Mm-hmm. Hospice is an open agreement. If it's working, great, and if it isn't, you have the prerogative to change.
Got it. Lots of good information, and LightBridge is a company that is in San Diego, been around for 20 years, has specialty programs, for all different types of folks. So their information is on screen, and you can learn more about LightBridge Hospice at their website. You can talk to Greg, you can talk to Jessica, you can talk to whoever at the company can answer the questions that you need to decide if hospice is right for you and your loved ones. Greg, Jessica, thank you very much for sharing all this wonderful information.
Thank you, Brian.
Thank you
for having us today.
Thank you.
Yeah, my pleasure.
Appreciate it.